So this is your EHR billing. So first step, as I told, right? When you enter, they would ask if you have insurance. Once you provide your insurance detail, they would verify it from the insurance company whether you're eligible or not for the treatments. The demographics are entered based on that. When doctor places orders, all this comes into being based on what all tests has been done, what all procedures were conducted, charges are generated. Then based on those charges, claim submission is done. So I have to send the insurance company telling that all this, I have done all these services, please pay me for that. And once that is done, payment posting starts. And there are parties who would see if whatever you're asking for is right or not. So they will do that. They will clear all that up. They would deny if they don't find it right. If it is right, they will just send across their statement, and based on that, reporting is done. Patient scheduling can be associated with this part itself. Can you move to next slide, please? Yeah. So till now, I just gave some words. Let's take one very simple thing. I entered as an outpatient, so I would go for steps. I came for registration, right? So they would check all my authorizations. Fine. And at the same time, as a patient, I'll be able to see what all data is present, and I should be able to modify my details in patient portal. Now, this patient portal is connected to EMR. Okay. EMR can send lab result or radiology, or they can send you to blood bank. Let's say some unfortunately event, somebody directly came to ER, they met an accident and they need blood bank. So EMR can talk to the blood bank. It is a hundred of activities, all that we have read. So simply you can just take that. I got registered, I met the doctor, doctor gave me medication, or when even after that I was not feeling well, doctor sent me for a lab test. If lab test was also not okay, I would get admitted as inpatient. Then everything you are all the services you are taking, everything is done, like eligibility is checked, prior authorization is done, claims are sent, payments are received, payment processing is done, adjustments are done. So all this is basically more or less what happens within hospital, and how other parties are associated with an EHR EMR systems. Can you move to next slide, please? So we spoke so much about EMR systems or EHR systems. Now, what are its advantage? Of course, it is more efficient. It is more accurate. Definitely reduces your cost. It reduces errors. It reduces risk, and it allows you take a faster decision. And everything is up to date, as everything is electronic. So every time medicine is given, changed, anything, everything is available. You're not missing one paper from your file, and your specialist is not able to understand that you're allergic to some medication. Also, very a few years ago, we used to face this issue. Doctors would have this one different kind of language writing, which definitely we could not read. Somehow pharmacists and other parties were able to read. So that actually created risk of errors. And now it is typed. So there are no chances because of that. Okay. It helps you provide easily healthcare quickly, faster, because you have everything in one shot. I need not turn 10 pages, 100 pages to look for what was patient history and what medications were given. I can see in one single screen, okay, patient has been given these medications. I need not look into full history for every person, but at least I can see for a month or two that, okay, these medications were given, these orders were placed, these results came in. So that helps me to quickly understand the picture of how the patient is right now and take a very quick decision on the spot. Can you move to next slide, please? Improve communication, of course. When two parties are working, let's say there is a old person who's very, very sick, and they also have heart issues, they also have lungs issue, maybe they also have very high sugar levels and all those things. So all these three parties can easily work together and not give any medication or any do any procedure that may intervene or create an adverse effect or because of the on other medication or other treatments that's going on. So yes, that improved communication is definitely helping us. Also, it is very quick. The moment provided us, it is typed, and the next person can immediately see that okay, this has been done with this patient on this date, this hour. So it is very cool. And definitely, if this is saving your time, it is definitely saving you money. It is also saving you from all those paperwork, administrative tasks, and all unnecessary things, duplicate procedures happening, duplicate tests happening. Because this test is done, this test is done. Next specialist would not go for it again because it is already. They can definitely see that it is already done. Can you move to next one? So, but there are some disadvantages as well. The biggest disadvantages that I came across was, I always felt was the physician, if they are like clinic based where they don't have full-fledged registering nurse or somebody who keeps writing for them, they spend a lot and lots of time on recording of what they are doing rather than talking to the patient. So this is a rough histogram which shows how much time each of different kind of physicians or providers spend during a day doing all this recording. So if you see specialists are like spending, it's okay. Specialists are spending more than 4 hours, and that is really bad because I don't know how many patients they will be able to take. Yeah, please move to next one. So when it came to cost, uh, it said that it saves money, but trust me, EHR EMR solutions are very expensive and they are very cumbersome. Implementation, they need lots of hardware, lots of software, and of course training. You have to train everybody. It takes hours to train. When people were switching from this paper based to electronic, it was very difficult because they were not at all connected to computer, and it was a very bad test for them, definitely. And there can be technical issues, there can be system breach, and Alok spoke about this HIPAA. If there is a data breach, it's a very big issue in healthcare because patient data cannot be mishandled. It is more important than bank details. So those issues can happen. So you have to be very conscious and take care of all this, and all this causes expenditure, time, and more resources are required. Can you move to next one? So also I said yes, adoption. I've already spoken of it. That the doctors were not ready, nurses were not ready. They were not ready to accept it. If they were ready, also it was difficult for them to accept it. There can be interoperability issues. Let's say that interoperability is in many places a separate tool that is working between two systems. So if any party has entered one wrong details, or if the interoperability party itself is the middleware tool person itself has entered some wrong data, or their system goes down, everything gets stopped. So that can also do happen. There can be data overload. Data overload can cause issues like system can get slowed down, or there can be medical issues. There can be many things. Okay. And security and privacy we actually spoke about. They can be hacking issues as well because it is not paper based. Anybody who's good hacker can also hack it, right? Can you move to next slide? Sorry. Was the future of EHR EMR. So the global EHR market was valued at 28.1 billion in 2022, and it is expected to go at 38.5 billion by 2030, and it is growing at 4%. Can you go to next, please? So these are different parties, big parties that are selling EHR solutions. So Epic has become a very strong party. It slowly captured other EHR solution providers market, and Cerner is a very old player. We have Allscripts, which is an old player, and it actually gave very nice solutions in old time. Meditech is also a very identified name. So these are basically major players. There are hundreds of EHR EMR solutions, and Open EMR is one system that is free. You can download, and you have to do database connection, and you can pretty much get all the advantage of an EMR EHR system, and you can play around with that. Can you move to next one? So this was something fun. I found it on LinkedIn. Uh, there's a poem on EMR. So what is an EMR? So it's a patient history stored with care, making diagnosis easy to share, no longer lost or left behind. Data that once was hard to find, available with just a click. EHR a modern day magic trick. With COVID-19, they are even more a vital tool at our core, allowing doctor to treat with ease, reducing risk and bringing peace. EHR streamlined cares, UC, making it better, more efficient and free. From duplicated tests to reduce weight, EHR improves health. It's no debate. So yeah, I just found that this poem covers everything in a go. It was nice. So can you move next? It's like questions. We are done. Please feel free to send in any questions. I will be happy to respond.
Colleagues, your questions, please.
Yeah, thanks a lot for the presentation. It was very helpful. Question, maybe I missed it. Sorry about that. But is EMR is always the same as EHR or not? Or it depends on the country, or it depends on the system? As a term the same or not?
So,
or sometimes
yeah,
the same, or sometimes not?
No. So first we have to understand one thing, that EMR is a terminology. EMR solution is a product. And yes, they are interchangeably used, but they should not be interchangeably used. EMR is concerned to one department. That means one instance I did something, it is one. You visited a doctor. What all happened on that date? That is one EMR. Okay. And
Yeah.
when we speak here about EMR or EHR, they are actually solutions. Okay. And they can be used interchangeably in market. They are actually used interchangeably nowadays. But the major difference between EMR was, let's say there is a department that is working. So it was all provider oriented. That means a doctor oriented. Okay. They can enter everything. They can keep it with themselves, and they can look into it whenever they want. So it was only department wise. Radiology had their own EMRs, and let's say bed and tray had its own EMRs, and everybody had their own EMR, but they were not sharing with each other. When the concept of EHR came down, they started that thinking that making rules, that how we can share this with other parties. This is the major difference between EMR and EHR. So it is EMR is limited to a department, and EHR EHR was doing everything that EMR was doing. Only thing, departments started sharing with each other. So EHR solutions started providing ways to share this information. But yes, it is unfortunately used interchangeably in many places. But they are actually two concepts.
Also, I think his question is whether the system remains same across globe. So I feel the core functionality will remain same, but different
Yes.
countries have different regulations and affordability also, because purchasing power of US is not same as India or maybe Pakistan, right? So they cannot purchase those software which have that much features in the which are available easily in the US, right? So
So they can be different kind of EHR or EMR solutions. I have worked with a product. It was a wound EMR EHR, and it did not look like your common solution. So usually when a EHR selling party, EHR solution selling party, that is a that's a company like Epic or somebody is developing. They develop for a huge audience, but there are other parties who sell EHR solution only for one certain department. So this product was a wound EMR. So they did not have so many functionality. They had more functionality towards orders and results because that is what they wanted, and history of illness. So their more focus was on this, and they did not had all the modules. They had one clinical decision support module very strong. Rest things were not in place. So it depends how that certain party requires it. Many EHR solution also give things like example is Cerner. They will sell you in small parts. So you can have, I can have demographic, I can have order result, I can have few of it. Maybe I don't need AI, I will not take AI, I will not take imaging. So based on my requirement, I can pick that. So definitely the biggest market for EHR is US, 100% sure. But yes, in different countries, it can play out differently. It can have lesser standard, it can have lesser module, it can do lesser automation. So the more automation you expect, the more costing it takes. And yes, based on that, different countries can have it differently. Also, yes, how the healthcare flow is in that certain country. Like in UK, everything is done by government. So all across, you will find majorly one single solution that is majorly used in one state or one place. But this is not true in America because in US, different hospitals will have different solution. I hope that answers your question, Nikita.
Yeah, it makes sense. Thanks.
Do we have any project solution in EPAM? I'm not aware of it. I'm sorry. I will try to find out, but I'm not aware of it right now.
Anything else, colleagues?
Hi, Alex. First of all, thank you very much for really interesting presentation you've done. I would like to mention that we actually do an R&D project here in the PAM, and we try to create an accelerator that helps us to create different kind of EMRs and EHRs with like builders, that allow us rapid construction of any clinical forms and so on, as you can imagine. That's really important to face different needs of our clinical different clinics. We would like to ask you if you are interested to participate in validation of this tool. I mean, to understand which features are implemented in a good manner and what we lack to enter this market in the nearest future.
Okay, sure. If we can contribute to it, it would be a great thing. It will be a great contribution. Would like to know more about it. Have some time so that I can research on it. All
Okay.
solutions are different, and all solutions have very different approaches.
Okay, that's really nice. I will write to you, and we'll send several materials for the at the beginning. And my question for the moment is, maybe you can tell some the biggest issues that you can see in current solutions that you would like to change. I mean, that really is not really impressive here at the moment.
I would say the costing is the very big issue when you come to EHR, EMR solution. Otherwise, it is pretty, it is very thought out, and there are many things that you can achieve if you are able to utilize all the features. Because in advance, we will cover more meaningful use and all those things, basics. And but definitely the biggest problem is the cost, the kind of training required, uh, that complete switchover, all the infrastructure, that is really heavy. If somebody can do something lighter than that, wherein we don't need so much of infrastructure, we don't need so much of training, so much of switchover, that would be really nice, is my key point. Maybe I can
Yeah.
do more research and get on that, but this is how I always felt along when I worked for EHR products. Yeah,
And yeah, thank you. Thank you very much. How many products did you see in your practice? Approximately.
in EPAM, are you asking? In EPAM, I've seen only one EHR. With a EMR, I was working with a client. Apart from that, I must have seen. I've actually worked on various products. I've also worked on risks, but I have seen at least three or four them, because I have worked for a firm where we were doing product engineering for EHR, EMR to meet meaningful use certification.
Yeah, that's great. So
Yeah.
you have general understanding
Yes.
of them. Yeah, great. Thank you. I will contact you directly. Thank you.
Okay. Thank you. Yeah, Christine, do you have any question?
Yeah, it was a question, one of the maybe more to Ivan regarding the challenges also, which I have seen on EHR systems, mainly subscriptions. Subscription in the sense of medical data change that you would want to send from various systems to the EHR. So whenever that condition changes, you know that EHR has, let's say, a standard integration, and how to capture that in a scaling manner, in an easier integration, let's say, modern way to capture that, streaming data coming from various sources on the EHR system. Similarly, like they have on Fire, for example, the Fire subscriptions. So to enable such functionality. And beside that, the integration. So integration is always a question, instead of everyone doing it his own way and, spending a lot of things on non-standard integration and so on.
Yes, that happens. Coming to Fire, if it is actually implemented well, I think it is very potent. And if it is not as bad as HL7 version 2, where um, one party could fall. I'll give you an example. I was integrating two software. One of them, actually three software I was integrating. So one party was totally following HL7 version 2 standards. Okay. Another party was following it semi way. And third party was actually not following it. They were just sending basic data. Major of data was coming in Z segments. And it was a very, 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 very difficult thing. And one party kept changing their data model. So yes, it was very difficult. But I think, more promising is Fire, because you're working more on API, so your designs are fixed. If something is being changed, you will be informed. So I think all informed changes can be done. this is what right now I think that fire is very promising, because to overcome all this problem version 3 came, but unfortunately version 3 was very difficult to implement. It needed lots of coding and it was very domain specific, so we could not pick it. All we did was from that was pick this CCDA documentation, CDA documentation, CCDA documentation, all that we are doing today. All those nice standards came from uh, that is in version 3. Fire is again based on this RIMDIM, but yes, it is simplified. Now we can just write APIs and we can pull data as we need. If we have permission, send data as we need. If we have permission from other party. I hope that answers your question. If you have more question in particular, please send in. I would be happy to respond.
Actually, it was not a question, it was a remark, because I implemented, fire integrations as well, so I know it well on various clients, and also EHR integrations. So, but that's a challenge. And version 3 of Fire, that was not easy to do. Let's say the Fire subscription was not well implemented, to be honest. Version 4 obviously makes it better. The thing is now on 5 and so on. Yeah, that was the things, to take into consideration when you have a scale, and as EHR systems, you need to be able to handle a lot of requests, from various parties and so on. If you do
I
such
personally feel that
integrations.
Fire is very new to be full standard. They did a great job, but I think yeah, as time goes, it will become very solid and we'll have lesser problems.
Yeah, thank you very much, Christian, for your remark, and actually completely agree what did you say. And this is exactly why we started this work. Actually, our accelerator already works on HL7 Fire. So we use native HL7 Fire server to store the data in this format. And we created this accelerator, this builder, to construct different clinical forms almost with low-code approach. That means really quickly, sometimes even without help of developer. It's enough to involve business analyst with knowledge of this HL7 file structure. If you don't mind, I will contact you directly as well. As I can see, this could be also useful communication.
For sure, would be very interesting, because if you build such things, would be nice also if we could propose to different clients, to accelerate their business as well, as I'm working also with the medtech life science in Europe. So I would be interested in such accelerator that you built.
Great. Then let's talk directly.
Yep.
Ivan, maybe somewhere in the future when you're ready, you and your team, you can just, I don't know, provide a quick overview or introduction of your accelerator, what it does, how it works. Because as a part of life sciences healthcare pre-sales team, I'm also very interested in knowing how it works and what value it can bring, because it's always one of our, differentiators or value propositions that we as a company can not start from scratch, but already bring something to the table that is pre-built and can reduce time to market, etc. So from my opinion, it would be very useful if you could make a short overview of what you've done.
Yes, of course. Thank you very much, Anastasia. Yes, we are really approaching that moment that we will be production ready. I hope it will happen even this year already. And obviously, we will inform people that are interested in. So, yeah, great. Yep. Thank you.
It would be great looking into a new product, because each product helps you unlearn what you have learned and learn new things. So thank you, everybody.